Well, this afternoon, the number of measles cases in Texas stands at 124. And with that number growing, there are many questions about the vaccine, especially from parents who don't want to vaccinate their children, but may be rethinking it. KENS 5 reporter Jeremy Baker explains.
Doctors say even though you may be hearing about people getting sick from measles, even if they are vaccinated, that it's still possible because the disease is so contagious and relies on 95% vaccination rates to reach herd immunity. That's just one vaccine question the parents have.
Why are they hesitant? This vaccine has been around since the 1960s and has been modified and made better over the course of time.
Another question she's been getting, can their child get the vaccine early? The first dose of the MMR vaccine is typically given between 12 and 15 months of age, but the MMR vaccine can be given to children as young as 6 months old. If your child gets the MMR vaccine early at 6 to 11 months, it's not a replacement dose, but it's given in addition to the 2 recommended doses.
If a child 11 months old was immunized with MMR, they would need to wait a month, which they normally would until a year of age, and then they could start their routine immunization series.
If you're wondering how measles is spread, it's through the air and via droplets. The measles virus can stay in the air for several hours after an infected person coughs or sneezes or on surfaces. You can get measles by breathing air contaminated by an infected person or touching an infected surface, and it does not require close contact with an infected person to transmit, which makes it that much more contagious and dangerous than COVID.
There are 2 different disease processes, but their effects with measles specifically in the children younger than 5, those effects are much higher in affecting that population more so than with COVID.
Experts say there could be mild side effects like pain or soreness around the vaccination site or a fever or rash that will subside after 6 to 12 days. Jeremy Baker, KENS 5.